to go somewhere for Thanksgiving, which is really against the recommendation of the health secretary right now, but say someone's going to go and do it anyway, but they want to at least try to be responsible about going to New York or, Ohio. They want to get a test. Where could an asymptomatic individual get a test prior to returning?
The easiest answer is to contact their healthcare provider for that test. The testing that is set up right now obviously prioritizes those individuals with disease or those individuals who may have been in contact with somebody with disease. So if you think about tests as a commodity, there's a limited commodity. So it otherwise you would have what I call the worried well come in and ask for tests. In that case, if the test was available, they would have to pay for it because it is not considered medically necessary.
Yeah. One of the things I found out by doing some research and talking to CBS was that it was like $139 if you just wanted to get your test, but I couldn't get an appointment. I mean, 3-4 days out is what they have, and you cannot get an appointment to get this test. Do you have a concern about that? Just kind of the ability of someone who, isn't necessarily feeling sick to get an appointment to get a test?
I think that now with this fall emergence, it is a challenge. And of course, I'm concerned that people would have to wait, because if somebody has symptoms and they have to wait 4 or 5 days to get a test, that's 4 or 5 days they potentially could be spreading disease to somebody else. So that's why the Commonwealth has created what I described earlier as a comprehensive testing plan that will increase from the 550 sites to almost 1,000 sites across the Commonwealth. And the sites that we're adding are not necessarily our retail partners. They will be public health sites, such as the federally qualified health centers, the county municipal health departments, and our own state health centers who will be bringing people in to do that testing.
A lot of the questions we're getting is because, in the nightly news, nationally, we're seeing these long lines and mass testing sites in Maryland, in Texas, in Arizona. Why aren't we seeing that type of thing in Pennsylvania? And why isn't there a push to have sites like we saw back in the spring where the Barnstormers play, or, at the fairgrounds, or, at Citizens Bank Park? Why isn't there something like that?
Sure. And you will see that in those focused areas. I spoke earlier about identifying the counties that had significant disease, and that we mobilize and basically literally set up tents to do the testing. The good news is, Ryan, that to date, we have done over 5 million tests. We've gotten 5 million test results. That is significant. That's about 40% of Pennsylvania's population. That's a good story to tell. The other part of it is because we are so successful with getting the tests out there, it may not be for those individuals that may want to just know, but it's for those individuals that really need to have a test, that have been a contact of the disease or have the disease themselves.
Yeah, and I agree with that. Every call that we have made to one of the medical providers, whether it was Penn State Hershey, whether it was LGH Penn Medicine, whether it was WellSpan, we have not had a problem with trying to figure out where you would go if you had symptoms. So I guess the question is asymptomatic. Ultimately, would you like to see people who are asymptomatic or even have a slight concern about where they were or who they may have come into contact with be able to get a test in the future? Maybe if it's something that can't happen right now, but in the future moving forward, because just to have that idea of, if I'm asymptomatic and, I work at a nursing home, or I, work at XYZ facility where I'm concerned about who I may interact with, to have that peace of mind, is that something you want to see happen?
Yes, the answer to that is yes. And I think that as you see more antigen tests being released that are new, and I spoke earlier about just released a new home testing kit, I think you're going to see that. I think that people will be able to order that test. Eventually, we should have over-the-counter testing, just like we would a pregnancy test or any other kind of test. You walk in and you request a test and you can test yourself. Absolutely. I would love to see that. And I think you're going to see that before too long.
I'm not surprised to hear you give that answer. But, one of the questions I had too is with these, the mandates and the orders and the recommendations coming from the health department about travel. Ultimately, I'm just concerned that people are just going to travel anyway and then not get the test because of the accessibility issue. Do you recognize that? Or are you concerned about that? That people are just going to, people are going to do what people do, and they're going to go away for Thanksgiving or for the holidays.
Well, obviously, we would prefer people didn't travel. I mean, we recommend do not travel, because when you travel, you have the potential not only to spread disease if you don't have the symptoms, but you have the disease, or you have the opportunity when you're traveling to bring the disease back. So obviously, we would prefer people not travel. We would prefer them to stay home. If indeed they need that test within 72 hours before they return or before they leave, then that's where they have to go and purchase that test. That's going to be through their primary care provider or to one of these other sites you mentioned, and to some people that may be cost prohibitive.
I think this is fair to say, but did you feel like the Department of Health was ready to make a move like the one that we saw yesterday to say, hey, if you do travel out of state, we need you to get a test, or if you're from out of state, you're coming here, we need you to be able to provide proof of getting a test?
Brian, I think it's a very smart move. We're in a very dangerous time right now. Our cases are spiking. There's no evidence that they're leveling off. And these mitigation efforts are based not on trying to make people miserable, but to basically save people from getting sick and to save lives. So it's a very smart move. And anything we can do to reinforce that public health message of that list of things we always talk about, we need to be doing that.
All right. How dangerous is asymptomatic spread? Just
it's
overall.
Significant. It's the same danger, but it's significant. It's so that the data is telling us now that there is more spread by asymptomatic individuals, meaning people who have the disease but they show no symptoms, than there was before. And that generally, Ryan, occurs with going to those small groups, parties, possibly restaurants, doing the large groups on a university setting, at the Greek houses, the parties, the football games. Those are the kind of areas that we really need to encourage people not to participate in.
And that's where you think people probably let their guard down, pull their mask down if they're at a family function or a close gathering of friends they feel like they interact with on a regular basis. Right?
It's hard to eat a hot dog and drink a beer with a mask on.